Thank you all for participating today and for being here in this very important conversation we're having. And you call it a press conference, but I think it's more of a conversation. And it's important for us to make the points that are necessary. And I think the main point that I will make is that the surge in youth usage of flavored tobacco products is truly shocking to everyone. Between 2017 and 2018, 1.5 million more youth started using flavored electronic cigarettes. 1.5 million, and the stunning growth amounted to a 78% increase in e-cigarette use by high school students and a 48% increase by middle school students. This unprecedented epidemic has even erased what had been decades of declines in youth tobacco use. 80% of young people who have ever used tobacco started with a flavored tobacco product. 80% of those who use tobacco products today started with a flavored product. Flavored e-cigarettes hook kids on nicotine and are considered by many in the scientific community as a one-way bridge to cigarette smoking for these kids. By prohibiting the retail sale of all flavored tobacco products, SB38 takes swift action to protect our youth and most vulnerable populations. I'm so grateful to my colleagues who are standing here with me today that have signed on as co-authors, as well as the youth and the public health officials and advocates who are here today to show support for this important, very important effort. We have seen this before. The false claims of safety, flavors used to hook users, and marketing obviously targeted towards youth. SB38 sends a clear message to big tobacco. California will not sit idly by as another generation gets hooked on nicotine. In fact, we may be too late already. So I'd like to introduce Assemblymember Kevin Mccarty, who is authoring our companion legislation today, Assembly Bill AB 739. Assemblymember McCarty?
There you are.
Thank you. Oh, there, I'm right there.
Yes, delicate dance here.
Yes. Thank you, Senator, and thank you for leading this effort on this with both houses stepping up on this issue. I also wanted to recognize Assemblymember Wood, Dr. Wood, who's chair of our health committee, who's working with me on this issue. And it is so important. I'm so excited to see our young students behind us. And this really is about the future. We know that with these, you look at these tobacco flavored products and the 15,000 flavors that are marketed across the nation, it really speaks for itself. We know that tobacco, these products don't taste like cotton candy and gummy kisses, but you know what tobacco does taste like? Cancer. And that's the truth, and that's the truth that we're trying to address here, as Senator Hill said. And it's clear that our industry is marketing to our youth. As was mentioned earlier, 80% of kids who have used tobacco start with flavored products. Especially alarming with our African American community, where 7 in 10 African American youth started smoking with flavored products, menthol. We need to change this across our state. Dozens of local governments are stepping up to pass restrictions or bans on flavored tobacco products, including my hometown here in Sacramento, who's working on this as we speak. But we need a statewide solution. A patchwork of laws are frankly confusing to local jurisdictions, and it's up to the state of California to step in where it's appropriate. And we, as legislators, know this, and we're fighting for a statewide solution. We have a responsibility to ensure that our future generation, young people behind us, aren't hooked on products because they started with a cotton candy product, which just sounds so innocent. We know that the research shows that smoking-related illnesses in our country addresses over $300 billion a year in costs, including $170 billion in direct medical care for adults and $156 billion in loss of productivity, including a great amount with secondhand smoke. That's why I'm co-authoring the measure with Senator Hill and authoring a companion measure in the Assembly. And there's just so much we don't know as well. I know there's the arguments from the industry that says this gets people off of the traditional cigarettes onto something more safe. But just like the tobacco industry decades ago, it wasn't until years later that we realized the deadly impacts of this product. And it's time for us to step up in California. Thank you.
And now I'd like to introduce Dr. Bonnie Halpern Felcher, Stanford Pediatrics professor and co-founder and director of the Tobacco Prevention Toolkit. Bonnie, there you are.
Good morning. So I'm very much in favor of SB38 for a number of reasons that I want to talk about. We'll talk about more later. First, as noted before, flavors hook young people. The people behind us, these young people who are brave enough to come up and say it, will say the same thing. There are over 15,000 flavors, as was said, and they're flavors that are meant to attract young and new users to tobacco. Fruit, candy, cotton candy, other similar flavors, but also mint and menthol that many think youth don't use, but they do. In fact, with Juuls, the #1 pod-based product and the #1 product youth are using right now come in mango and mint and menthol, and those are the flavors that youth are most likely to use. And not only are they using these, but they're 4 times more likely to then go on to use conventional cigarettes. Most adolescents will tell us that they started using tobacco because of the flavors and that they would quit using tobacco if these flavors were no longer available. The other concern is that flavors mask the risks that are inherent in tobacco, including the fact that many e-cigarettes, and in particular the newer pod-based e-cigarettes like Juul, have as much nicotine, and this is concentrated nicotine, that we can find in 1 to 2 packs of cigarettes. And lastly, as was mentioned before, there's absolutely no evidence that adults who are smoking conventional cigarettes need e-cigarettes and need flavors to go on to stop smoking. So it's very, very clear that there's extraordinarily high levels of nicotine in these products that youth are using, that they're becoming addicted to these products, that they're using these products because of the flavors, and that's not just e-cigarettes. We see flavors in all forms of tobacco products, and that adults really do not need these products and these flavors to quit smoking. And that's why SB38 is so incredibly important to help and continue to help the health of our children. Thank you.
Thank you, Bonnie, very much. Now I'd like to introduce Dr. Philip Gardner, founding member and co-chair of the African American Tobacco Control Leadership Council. Doctor, welcome.
Thank you, Senator, and good morning, all. If there's one thing that California legislature could do that would save more lives and protect the public health, it would be to remove menthol-flavored cigarettes, all flavored tobacco products from the marketplace. The bottom line here is that flavors, and menthol in particular, makes the poison go down easier. That's why the tobacco industry puts it in there. The Juul explosion that everybody's been talking about really has been a flavors explosion. It has captured that imagination, and not only the imagination, the brains of young Americans. But let's be clear, this is not just a youth issue. Even though it's important, this is for adults too. Menthol cigarettes have been disproportionately marketed to African Americans for over half a century. We're talking about here is that menthol in cigarettes allows for things to go down easier. You take in more toxins, you take in more nicotine. The more toxins and nicotine you take in, the harder things are to quit. We have data that shows that menthol cigarettes are much harder to quit. And then there's the predatory marketing of these products. In the African American community, menthol cigarettes have better discounts. They are more advertised, and I guess what upsets me the most, they're cheaper. We have data from both the East Coast and West Coast to confirm this. Let's look at it this way. This is not just about kids, or nor is it just about African Americans. Women's disproportionately use menthol cigarettes. Folks from the LGBTQ community disproportionately use these products. Native Hawaiians do, Puerto Ricans do, folks with mental health issues do, Filipinos do. Look, already numerous cities in California, including San Francisco, Richmond, Beverly Hills, Alameda, San Pablo, Hermosa Beach, and as mentioned, Sacramento is hopefully joining them, are doing this. I want to say to you that the African American Tobacco Control Leadership Council strongly supports SB38. It would take the lead in California, and it would be a beacon for lead for the rest of the country. And thank you for your time this morning.
Thank you very much, Doctor. Now I'd like to introduce Senator Anthony Portantino. Senator Portantino, thank you.
Thank you, Senator Hill and Assemblymember Mccarty, for your leadership on this issue. I'm proud to be a principal co-author of SB38, and I'm here as a dad. You know, my daughter's 17 years old. We talk about this issue often, and she tells me it's prevalent. She tells me, Dad, it's going to be hard to eradicate. So let's think about that. Why is it going to be hard to eradicate? Because these products are directly marketed to kids. There's only one reason to make it flavored, and that's to attract young people to get addicted to this product. Not only is it flavored, but then let's look at the device that is used to inhale. It's disguised. Why is it disguised? So it can be hidden. If you have to hide a product and you have to flavor a product, it doesn't take, and I'm glad we have a doctor here, and many doctors here, it doesn't take a doctor to figure out that it's bad for you. So let's just focus on that. This is being marketed to kids. It's being hidden from adult supervision. It's prevalent in our schools. It's prevalent in our summer camps. It's prevalent on our streets and in our homes and in our communities. We need to take a statewide approach to this. It's also very important to hear the statistics on menthol and the impact on communities of color. This is a broad conversation that needs to be at the forefront of the public health and youth and community health discussion. I want to give a shout out. I understand San Marino High School is in the house, so I want to give a big shout out to San Marino High School, which happens to be in the 25th Senate District, and to see young people here joining us for this conversation and joining us for this very, very important public health. Their future depends on us doing the right thing, and doing the right thing is banning flavored tobacco in the state of California. So thank you all for being out today, and thank you for the leadership of my colleagues.
Thank you, Senator Portantino. Now, Senator Steve Glazer. Steve?
Thank you. Thank you, Senator Hill. I'm so pleased to be a joint author with you of this important legislation. A few weeks ago, I had some middle school children in my office, about 20 of them, and I asked them if they had friends who had vaped. And almost all of them said yes. They said, it's everywhere. It's in our hallways. It's on our play fields. It's even in the classroom. And it's no big deal to them. It's so common. Well, that is simply unacceptable. As has been discussed, these e-cigarettes come in these sweet flavors: cotton candy, bubble gum, mango, and many others. Here we see it advertised as watermelon or strawberry. The packaging and the flavors intentionally to appeal to our children. And has been said already, 80% of young people who have ever used a tobacco product started with a flavored product. These e-cigarettes, they're infecting the health of millions of our children. It's addicting them to nicotine, it's a gateway to tobacco use, and it engages them in illegal conduct. We must act urgently to curtail this use by our children. And to me, I feel great urgency, and that's why I'm pleased to be a joint author of this bill, and I appreciate all the great support from our colleagues in the Assembly and the Senate, and I look forward to passing this this year. It's very important that we do that. Thank you, Senator Hill.
Thank you, Senator Glazer. Now I'd like to introduce Assemblymember Jim Wood. Jim? Thank you for your leadership.
Thank you very much, and I too am pleased to be a co-author of this bill, SB38, and the companion measure, AB39, in the Assembly. Let me just say, I've not been a friend of the tobacco industry for most of my career, and I'm extremely proud of that. I'm here today to make sure that we do everything we can to see that this bill absolutely passes. I'm a dentist by training, and as such, I've seen the harm that the tobacco products do firsthand on my patients for years. As the mayor of Healdsburg, in 2014, we passed the first restriction to purchase tobacco products to age 21 in the state of California, and 2 years later, we did it at a state level. We also did that with vaping products as well. The challenge is keeping these products away from kids. And now the industry is looking for clever ways to get kids hooked, and it's unacceptable. It's beyond the pale that tobacco and e-cigarette industry is targeting the younger generation, because they need that younger generation to smoke or vape by flavoring these juices. We've already heard that 80+% of kids who've used tobacco products started with a flavored product. We know the toll these products take on real people, and we cannot dismiss the $13 billion in direct health care costs to the use of these products in California. E-cigarette addiction and disease may currently be available in assorted flavors like strawberry shortcake, ice cream, mint to be. Well, you can take whatever flavor you want, but I want a flavor that's called banned forever. Thank you.
I like that flavor too. It's a good one. And now I'd like to welcome Assemblymember Al Martucci. Al?
Thank you very much, Senator. I am joining legislators from throughout the state of California. I represent a coastal district of Los Angeles in strong support of this effort to ban the flavored tobacco products. You know, I'm here not only as a state lawmaker, but like Senator Portantino and others up here, as a parent. You know, as a parent, I am hearing about, I talk to so many parents who are so worried about this crisis, this public health crisis of teenage vaping, just overwhelming our young folks and our children. And, you know, I'm hearing stories like the disguising of the e-cig devices, you know, anything from being in pens to, you know, the worst that I heard was a device that was hidden in the drawstrings of a hoodie, where you can draw on the strings of a hoodie in the classroom. You know, this is the extent to which this industry is going. You know, the big tobacco is going after, you know, our youth to hook them onto these addictive products. And so this is a public health crisis that needs to be addressed urgently, and that is why I'm in strong support of our legislative efforts to ban these products.
Thank you, Assemblymember. And we're so blessed today to have so many youth with us today. So many young adults and kids that really are the victims of what the tobacco industry is doing, but they're standing up. And I think that's so special, so important, and so telling about the youth of our country. So now I'd like to introduce Brandon Hardin, the Youth Ambassador for Campaign for Tobacco-Free Kids. Brandon?
Good morning. My name is Brandon, and I'm a senior at Waterford High School in Stanislaus County. The tobacco industry has changed so much in the past few years. They've introduced new vapor products in candy and fruity flavors. These flavors seem like they belong in a candy store or ice cream parlor. Flavors like cherry dynamite, berry slushies, s'mores, and watermelon. These products are increasingly popular among high schoolers, and believe it or not, middle schoolers as well. The tobacco industry knows that these products target youth disproportionately, which is exactly why they keep selling them. More than 8 out of 10 kids who have ever used tobacco products started with a flavored product. 8 out of 10. Flavors like menthol and strawberry lure kids in, and the nicotine forces them to keep coming back for more. The tobacco industry knows that for every teen that is hooked on these fruity flavors, they will have a lifelong customer of their products, a lifelong source of income. I traveled to Sacramento from my hometown of Waterford this morning to support Senator Hill's efforts to end the sale of flavored tobacco products in California, including menthol cigarettes. I'm here to speak for change, to speak out against the tobacco industry and the negative impacts I've seen them have on my community. I'm here to represent my generation and to stand in solidarity with state legislators as we stand up against big tobacco together. Thank you.
Thank you, Brandon. Very, very powerful. And now Lisa Liu, Youth Ambassador for International Youth Tobacco Control Organization. Lisa, welcome.
Thank you. My name is Lisa Liu, and I'm the founder and president of International Youth Tobacco Control, a nonprofit organization comprised of 200 high schoolers in the US, Canada, China, Pakistan, and Saudi Arabia. We seek to prevent teenage smoking globally through legislative reform and educational activities, already reaching 3,000 youths. Today, my representative members and I travel from Los Angeles to here because we notice an epidemic that is hunting our very own state. an epidemic that is going to take the lives of millions of teenagers. Flavored tobacco products. Stories that we've heard and incidents that we've witnessed have told us that we need to take a step to ban flavored tobacco products. 21-year-old Julian Blake, who started smoking and vaping as a high school sophomore, testified that he cannot live for an hour without vaping and without his Juul because, quote, you can't let go once you start using it. 15-year-old Luka Kindred, he was a high schooler who was an A student, but recently he began selling his clothes in order to purchase products of flavored tobacco. He was a Boy Scout member, serving his community, but now he locks himself up in his room, vaping. And he dropped from an A student to an F student. See, these teenagers, they were just like us. They had people whom they loved and dreams that they wanted to pursue. But flavored tobacco products rendered their bright futures dark and their strong bodies weak. It's time that California stand up against big tobacco to protect our teenagers. So we today implore the California Senate, on behalf of all teenagers, to pass Bill SB38 and end the sale of flavored tobacco products. And one day I hope that Luka and Julian can stand at this very spot to advocate for public health because they were able to benefit from this legislation. Thank you.
Thank you, Lisa. That was wonderful and very powerful. Our final speaker today is, and kind of representing the Athletes Don't Vape, is Taylor Barker, student athlete and member of Athletes Don't Vape. Welcome.
Thank you. Good morning. My name is Taylor Barker. I'm 15 years old and I attend Foothill High School in Shasta County. Today I'm here with Athletes Don't Vape to share with you what is happening in your public schools. Over the last several years, vaping in school has become extremely popular. Roughly 6 out of every 10 students that I talk to have vaped before or are currently vaping now. Some kids bring their vapes to school. And vape in the bathrooms, which has gotten the nickname the Juul Room. I have a friend with asthma who can't use the bathrooms at school because the vaping causes her to have a hard time breathing. And as shocking as it is, some kids even vape in class. It is so common to vape now that it is a social norm, and if you don't participate in it, you are made fun of. And keep this in mind, this isn't the burnouts and partiers, it's also the star football players and AP students. The probability that your kids or grandkids vape is highly likely. What makes matters worse is that many students are becoming addicted to nicotine and don't understand the dangers. I've seen kids not eat lunch and use the lunch money their parents gave them to buy vape juice. Kids get too caught up in the fruity, trendy flavors to realize the dangerous chemicals they are putting in their bodies. Online marketing has made it easier than ever for students to obtain access to these nicotine devices without their parents ever knowing. I have a clean-cut 16-year-old friend who orders vaping products in bulk online, then sells and distributes these products to other students. Without your help, I only see matters getting worse. I am genuinely scared and concerned for the youth and generations to come. With that being said, I respectfully request that you consider what can be done to protect your students from the growing threat of vaping and the dangerous health effects created as well. Thank you.
Thank you very much. That was very nice, Taylor. Thank you. And thank you to Athletes Don't Vape for being here today and for your support. It's wonderful. That was our final speaker. And you can see where California is well represented here, legislatively and by our speakers and by the students. Be happy to entertain any questions for our members.
You're saying all tobacco products. This is going to cover cigarettes, chewing tobacco, cigar products?
Menthol cigarettes, any tobacco product would not be allowed to have any flavor attached to it.
Taylor brings up a great point. If you're successful in having this law passed in California so that retailers and vendors can't sell these products in California, what's to prevent students from going online and getting these products from?
Well, this will not prohibit the online sale of flavored products, tobacco products at all. But what a companion bill that I have, which is SB39, that legislation will treat tobacco products the same as we today treat alcohol products. When you order something online, it has to be sent in a package that's clearly marked. This is a tobacco product. It contains tobacco and must be signed and received by someone over 21 years of age with a signature, just as we do with alcohol products. Because what we find is over 90% of those young adults who order online, they get it delivered to their home and they throw it on the porch, just as we get our Amazon packages thrown on the porch. And that's what tobacco, how it's delivered today. We want to change that as well. So this will be the same for some of the arguments against the legislation is that, well, we're banning flavored tobacco products. Well, we're not. You could still buy them online as an adult if you'd like, and it's just now, it's check and check and check before you receive it. So.
I'm wondering too, is the dental community seeing any health risks or health impacts to kids who have been vaping for a short period of time in terms of oral cancers or breathing difficulties, things that you might be seeing in a dental office?
I think it's a little early to tell on that. I think the more alarming thing to us is the transition to regular tobacco products, which we know are absolutely deadly in the long run. So I think it's a little early to tell, but we're actually looking for that, and I haven't seen research to support that, but it's really the trend that takes kids to the other tobacco products.
And I think if you were to look at this poster that we put together here, you see e-cigarette users are 56% more likely to have a heart attack and 30% more likely to suffer a stroke. That's long-term, that's not necessarily youth, but that is a statistic that was put together by the American College of Cardiology related to e-cigarettes. And 74% of youth who use Juul flavor pods obtain the device from physical retail locations. So I think this really identifies the challenge the effect of what we're seeing from the Juul marketing campaign. And they'll tell us today in the committee that, well, we're a tobacco cessation product. We're trying to get people to not use a tobacco or cigarette product or something else. But they're owned by a tobacco now. Much of their company is owned by a tobacco company. They're no different than the other tobacco products that we've seen, and their marketing and the tools that they use, as my colleagues mentioned, and the tricks that they play, and those that the doctor mentioned, Dr. Gardner mentioned about the marketing campaign, the lower cost, the lower pricing for menthol cigarettes, just to get anything, to get that product into your hand and get you hooked, and that's what it does. Other questions? We'll see.
Senator Hill, you mentioned advertising tobacco industry explicitly advertising to kids. Is there any plan to passing legislation to stop that practice?
Well, I think there's other legislation that will be looking at that as well this year. But they will claim and they will do a lot. I mean, the companies will say they're not going to be doing that. They're changing their ways. But we've heard that story many times before. Assemblymember.
And also, if you take out the flavored, that's the incentive for the advertising. They're advertising the bubble gum, the gummy kisses, the cotton candy, and that's really the hook to go after these youngsters. So taking out the flavored component of it, it cuts off the advertising tool to go after our youth.
Very good. Thank you very much for being here today, and thank you to my colleagues for their great support and words of wisdom, and for the speakers today and their leadership, and to the kids. Thank you very much. So great. Thank you.